That's right, I'm back with another episode of Med School Radio, and we're looking at some more educational objectives. Let's get right to it, starting with Fragile X syndrome. What is this caused by? This is caused by an increased number of CGG trinucleotide repeats on the Fragile X mental retardation gene, and that is FMR1 on the long arm of the X chromosome, and this leads to hypermethylation and inactivation of FMR1. So remember the CGG trinucleotide repeats, Fragile X mental retardation, FMR1 gene on the long arm, leading to hypermethylation and inactivation of FMR. Okay, what is a two-sample t-test? A two-sample t-test is a statistical method commonly employed to compare the means of two groups of subjects. Very simple. Okay, here's a question for you. Think about interleukin 4. What does this stimulate? This stimulates antibody isotype switching, particularly to IgE. Okay, one more time. Interleukin 4 stimulates antibody isotype switching, particularly to IgE. Okay, let's think about pheochromocytoma. What do you know about that? So we know it's a tumor. And what does it arise from? It arises from the chromaffin cells of the adrenal medulla, characterized by excess production of catecholamines. Clinical features include episodic hypertension, diaphoresis, and palpitations. Microscopic examination of the tumor cells shows electron-dense, membrane-bound secretory granules, and immunohistochemistry is positive for synaptophysin, chromogranin, and neuron-specific enolase. So these are some difficult things that might come up on a question. Sure, you understand pheochromocytoma, but looking at it microscopically, what are you going to be looking at? With immunohistochemistry, it's going to be positive, one more time, for synaptophysin, chromogranin, and neuron-specific enolase. Okay, do you know how to calculate the net filtration pressure? It's calculated by the following equation. Net filtration pressure equals, in parentheses, PC minus PI, parentheses closed, minus C minus I. Okay, so there we go. Next one. The reduced cardiac output in heart failure triggers compensatory activation of the sympathetic nervous system and renin-angiotensin-aldosterone pathway, resulting in vasoconstriction, which is increased afterload, fluid retention, increased preload, and deleterious cardiac remodeling. These mechanisms perpetuate a downward spiral of cardiac deterioration, leading to symptomatic decompensated heart failure. We've done this one before, but it's always good to repeat them. Okay, let's move on to the next one. What do you know about epistaxis? This is commonly caused by irritation of the highly vascular mucosa at the anterior nasal septum. So if you're having a question is asking where it's happening, remember it's the anterior nasal septum. The anterior nasal septum contains the Caselback plexus, the anterior ethmoidal, sphenopalatine, and superior labial arteries, anastomose, in this region. Okay, one more time. The anterior ethmoidal, sphenopalatine, and superior labial arteries, anastomose in this region, the anterior nasal septum. That's where you would get epistaxis. What is cyproheptadine? Cyproheptadine is an antihistamine with anti-serotogenic properties that can be used as an antidote in severe cases of serotonin syndrome that do not respond to supportive measures. So remember, cyproheptadine. Cyproheptadine. Okay, remember the difference between something that is accurate and something that is precise. We've talked about this before. Let's go over it again. A precise tool is one that consistently provides very similar or the same value when measuring a fixed quantity. An accurate tool is one that provides a measurement identical or similar to the actual value as reflected in gold standard measurement. And this type of question comes up when they show the targets and they want you to choose perhaps the one that is closest. That's in the explanation, but you have to understand the difference between a measuring tool that is precise and one that is accurate. Remember Chiari malformations? Chiari malformations are congenital disorders that result from underdevelopment of the posterior fossa, causing parts of the cerebellum and medulla to herniate through the foramen magnum. Chiari type 1 is relatively benign and presents during adulthood with occipital headache and cerebellar dysfunction. Chiari type 2 is more severe. This form affects neonates and is often associated with lumbar myelomeningocele and hydrocephalus. So remember, Chiari type 2 is the more severe one that affects neonates. Okay, let's think about Clostridium difficile again. Clostridium difficile commonly presents with diarrhea and abdominal pain. Hospitalization and antibiotic use increase the risk of contracting the disease. A nucleic acid amplification test is considered the most sensitive method for diagnosis of C. difficile infection in patients with clinical symptoms. So remember, if it's asking you what is the test that is most sensitive, it is a nucleic acid amplification test. Think about Hippel-Lindau disease. Sporadic and hereditary renal cell carcinomas, which are associated with von Hippel-Lindau disease, are associated with mutations involving the VHL gene on chromosome 3p. The VHL gene is a tumor suppressor that inhibits hypoxia-inducible factors. Mutations lead to constitutive activation of these proteins, resulting in the activation of multiple angiogenic and tumorigenic growth factors, for example, VGEF and PDGF. So remember that the VHL gene inhibits these factors, the hypoxia-inducible factors. And when this goes bad, the mutations lead to activation of these proteins, and you would have activation of multiple angiogenic and tumorigenic growth factors. So VGEF they're talking about, and PDGF. Okay, let's talk about hemangiomas. Cutaneous strawberry-type capillary hemangiomas are common, benign congenital tumors which are composed of unencapsulated aggregates of closely packed, thin-walled capillaries. Initially, strawberry hemangiomas grow in proportion to the growth of the child before eventually regressing. And in 75 to 95% of cases, the vascular tumor will regress completely by age 7. So the question may be asking whether or not they disappear by themselves, and they do. Okay, what do you know about tamoxifen and raloxifene? Selective estrogen receptor modulators, for example, tamoxifen and raloxifene, are competitive inhibitors of estrogen binding to estrogen receptors. They can have agonist or antagonist effects depending on the specific tissue. Tamoxifen has estrogenic effect on the uterus and can cause endometrial hyperplasia and cancer. So remember these SERMs, tamoxifen and raloxifene. What do you know about the diphtheria toxin? Diphtheria toxin and Pseudomonal exotoxin A act by ribosylating and inactivating elongation factor 2, which inhibits host cell protein synthesis, causing death. So the question may be asking how this toxin works. So one more time, diphtheria toxin and Pseudomonal exotoxin A act by ribosylating and inactivating elongation factor 2, which inhibits host cell protein synthesis and causes death. Neisseria meningitidis. What is this transmitted by? It is transmitted primarily by aerosolized droplets and subsequently colonizes the nasopharyngeal epithelium. Penetration of the epithelium can lead to bloodstream infection. Spread of the meninges occurs via transcellular penetration of the cerebellar capillary endothelium or entry at the choroid plexus. Now there's so many questions that can come out of there, so you really need to understand each of these elements. It's very detailed, so I'm going to read it again a little bit slowly. Neisseria meningitidis is transmitted primarily by aerosolized droplets and subsequently colonizes the nasopharyngeal epithelium. Penetration of the epithelium can lead to bloodstream infection. Bloodstream infection. Spread to the meninges occurs via transcellular penetration of the cerebral capillary endothelium or entry at the choroid plexus. A lot to remember there. Here's a quick question. Is premature ejaculation related to diabetes? No, it isn't. Okay, let's think about Müllerian aplasia. Do you know Mayer-Rokitansky-Kuster-Hauser syndrome? Patients with Müllerian aplasia, i.e. Mayer-Rokitansky-Kuster-Hauser syndrome, have no upper vagina. For example, they have a short vagina and variable uterine development. These patients are 46XX females with normal ovaries and secondary sexual characteristics. Okay, we've had so many questions about hepatitis B, and sometimes they're so confusing, the hepatitis is. So we're going to go over it again. Individuals who are successfully immunized against hepatitis B virus develop the protective anti-HBs antibody. Individuals who recover from hepatitis B infection, however, have anti-HBs as well as anti-HBC antibodies. The presence of circulating HBsAg indicates active infection. Those you just have to go over a bunch of times before they become second nature. Okay, what do you know about vitamin A overuse? What happens if you down a whole bucket full of vitamin A? This can result in intracranial hypertension, skin changes, and hepatosplenomegaly. Okay, we'll do one more. Let's talk about dilated cardiomyopathy. So this results from direct damage to cardiomyocytes, leading to myocardial contractile dysfunction, systolic dysfunction, volume overload, and ventricular dilation. Viral myocarditis is a common cause of dilated cardiomyopathy and should be suspected in young patients who develop heart failure following a symptomatic viral prodrome. So consider viral myocarditis in this case. Okay, thank you very much. And tune in again to Med School Radio, and we will go over some more concepts. And I really recommend this method for you also in order to learn these concepts. Thank you very much.